Approximately in 2011, I experienced a series of symptoms which included temporarily losing my sense of smell, chest tremors, and depression. Being uncertain about the cause of these seemingly unrelated symptoms, I swallowed a capsule of the amino acid tyrosine for depression, and my symptoms improved by about 70%. Are these symptoms idiopathic Parkinson's or secondary Parkinsonism? Secondary Parkinsonism is similar to Parkinson's disease, but the symptoms are caused by certain medicines, a different nervous system disorder, or another illness. A meta-analysis of 5 studies determined 86% sensitivity and 83% specificity in distinguishing Parkinson's disease from vascular Parkinsonism, and 86% sensitivity and 98% specificity in distinguishing Parkinson's disease from drug-induced Parkinsonism. My father had Parkinson's disease. Did I have exposure to insecticides and herbicides? Yes, including Monsanto's Roundup, which is linked to autism, Parkinson's, and Alzheimer's disease. For 2 years I worked as a greenskeeper and once sprayed Monsanto's Roundup in the grass path around the lawn bowling fields. It is 260 by 140 feet, and it is 8 feet wide. I did most of the spraying on my hands and knees. Did I drink 16 ounces of milk a day at midlife? No, I'm lactose intolerant. Did I have any sinus infections? Yes, I had 3 sinus infections which required antibiotics. Did I drink diet soft drinks which contain aspartame? No, in a study aspartame decreases dopamine levels in the rat brain. Parcopa is an orally administered formulation of carbidopa-levodopa, which rapidly disintegrates on the tongue and does not require water to aid dissolution or swallowing. Parcopa contains aspartame. In a European patent application, aspartame is made from the waste products, the feces of cloned E. coli bacteria. Do I cook in aluminum or Teflon-coated pans? No. Use fluoridated toothpaste, prior to Parkinson's. Drink from aluminum cans, in the 1980s. Drink fluoridated water, yes. Use deodorants with aluminum chlorohydrate, not since the 1990s. Did I arc weld or mine manganese? No, but I had 2 years of oxyacetylene welding experience. Oxyacetylene welding produces carbon monoxide, and the welding rods are coated in flux, which may contain iron. Did I drink 1 cup of black tea a day? No, mostly coffee with the occasional cup of green tea. Did I smoke cigarettes? No. Did I eat lots of peppers? Yes. Did I eat an apple a day? Yes. Did I take ibuprofen for pain? Yes, but infrequently. Does my family have a history of goiter? Yes, my maternal grandmother. Do I have a history of concussion or head trauma? No, but I was involved in 2 auto accidents in which my head was impacted in both collisions. In a UCLA mouse study, traumatic brain injury increases the risk of Parkinson's disease by 15%. The threat doubles with exposure to the pesticide paraquat. Parkinson's disease is related to tuberculosis, leprosy, and Crohn's through genetics, various symptoms, and therapies. A relationship has also been established with lipopolysaccharides through laboratory testing and the accidental contamination of a lab assistant. This led me to ask, are there any other pathogens associated with Parkinson's disease? The bacteria Helicobacter pylori resides in the stomach and is a source of gastric ulcer and cancer. 50% of the world's population is infected with H. pylori. Infection of late middle-aged mice with a strain of H. pylori resulted in the development of Parkinson's disease symptoms after 3 to 5 months. 4,484 newly diagnosed Parkinson's patients were surveyed, and the study revealed a 45% increase in the likelihood of developing Parkinson's if treatment for H. pylori infection was done in the prior 5 years. In Sydney, 76 Parkinson's patients were tested for H. pylori infection, and 27 were positive. These patients underwent 1 week of antibiotic therapy, and 12 weeks after eradication, levodopa onset time was significantly reduced and on-time duration was increased. It would appear that H. pylori is having some form of interaction with drugs such as levodopa, and delaying action of the drugs in these people. The other completed trial sought to find a causal link between infection with H. pylori and Parkinson's was non-contributory. A worsening of symptoms was noted with eradication failure. Unfortunately, this study revealed a strong cautionary note. Antibiotic treatment does not always cure H. pylori infection. 20% of the patients receiving antibiotics remained infected with H. pylori, and the patients deteriorated more rapidly than those who were not treated at all. Streptomyces venezuelae, a common soil bacteria, produce a chemical toxic to dopaminergic neurons. Proteasome inhibitors can potentially damage dopaminergic neurons by blocking protein degradation and thus causing the proteins to misfold and clump. The roundworm C. elegans were exposed to proteasome inhibitors derived from Streptomyces venezuelae, and dopaminergic neurons died as they aged. By no means do we feel this is anything of a conclusive nature, yet. Based on the elevated incidence of Parkinson's disease, a neurodegenerative disease associated with rural living, drinking well water, and farming as a profession, we hypothesized that more neurodegenerative metabolite-producing organisms would be isolated from rural soils than urban soils. Soil sample analysis of agricultural, undeveloped, and urban areas revealed 38% of agricultural, 35% of undeveloped, and 11% of urban areas contain neurodegenerative metabolite-producing strains of Streptomyces. Interestingly, significantly fewer Streptomyces species were isolated from undeveloped soils compared to agricultural soils, suggesting that land use alters the soil environment for Streptomyces. Dr. Caldwell and colleagues also discovered movement disorder symptoms are lessened by an antibiotic. Treating worms with ampicillin helps restore normal movement. Dystonia is a disorder characterized by involuntary muscle contractions that cause slow repetitive movements or abnormal gestures. In a roundworm animal model, they identified the antibiotic ampicillin as an activator of the protein torsin A, which is linked to early-onset dystonia. In human dystonia patient cells, ampicillin was efficacious and restored the patient cells back to the normal function, and the drug restored normal movement to mice that were genetic mimics of dystonia. Nocardia asteroides also produce proteasome inhibitors. There is a proteasome inhibitor rat model of Parkinson's disease. According to the Centers for Disease Control and Prevention, Lyme disease is caused by the bite of Ixodes scapularis, the black-legged deer tick. Its classical presentation features a bullseye rash, fever, headache, and fatigue. The tick bite transmits the bacteria Borrelia burgdorferi. Borrelia burgdorferi, the bacteria which causes Lyme disease, is classified as a spirochete, a corkscrew-shaped bacteria nearly identical to the bacteria which causes syphilis. Nobel laureate Dr. Lida Mattmann wrote the definitive text on L-form bacteria, cell wall deficient forms, stealth pathogens. Dr. Mattmann identified 2 different species of L-form bacteria in patients with Parkinson's disease. Dr. Mattmann recovered Borrelia spirochetes from 8 of 8 cases of Parkinson's disease, 41 cases of multiple sclerosis, 21 cases of amyotrophic lateral sclerosis, and all tested cases of Alzheimer's disease. When the brain becomes inflamed due to infection with the Lyme bacteria, cells called macrophages respond by releasing a neurotoxin called quinolinic acid. This toxin is also elevated in Parkinson's disease, MS, and ALS. Quinolinic acid neurotoxicity causes the overactivation of the NMDA receptor and glutamate accumulation, inhibition of mitochondrial functioning, decreases antioxidant activity, and increases reactive oxygen species in the Fenton reaction. And all of the above encourage cell death. Of the 6 polyphenols examined, curcumin and epigallocatechin gallate, EGCG from green tea, attenuated to a greater extent the effects of quinolinic acid than did the other compounds tested. In the article, Quinolinic Acid Endogenous Neurotoxin with Multiple Targets, the authors identify compounds and their positive method of action against quinolinic acid-induced toxicity, the sleep aid melatonin, the MAO inhibitor Deprenyl, the iron chelator deferoxamine, reduced glutathione. Interestingly, the most frequently referenced supplement is the mineral selenium. In the NeuroResearch Parkinson's abstract, 400 micrograms of selenium is given as daily therapy. The seleno-organic stroke medicine Epsilon, acetyl-L-carnitine. With additional internet searches, I found the following supplements to have attenuating effects against quinolinic acid: minocycline, theanine, beta-carboline from ecuniprurians, magnesium, folic acid, N-acetylcysteine, and cobalamin. The intrastriatal quinolinic acid administration induces a marked expression of tumor necrosis factor and interleukin-6 that can be attenuated by inhibiting the cyclooxygenase 2, COX-2, and ibuprofen is a COX-2 inhibitor. The results show that ibuprofen significantly reduced quinolinic acid-induced lipid peroxidation. The results of the present report therefore suggest a possible mechanism for the neuroprotective effect of ibuprofen. Additionally, the neuroprotective effects of ibuprofen against toxicity induced by rotenone appear to be attributable to its antioxidant properties, in addition to cyclooxygenase inhibition. We checked the effect of ibuprofen on the kynurenine pathway. We found that ibuprofen evoked a similar pattern of change in the kynurenine pathway as valproate. Valproate produced a progressive and strong increase in the central concentrations of kynurenic acid, kynurenine, and tryptophan. Preclinical data suggest that intervention in the kynurenine pathway may result in neuroprotection and may alleviate L-DOPA-induced dyskinesia. In conclusion, the current study suggests that ibuprofen and piroxicam are promising candidates for neuroprotection in Parkinson's disease and may have utility in conjunction with L-DOPA in order to ensure the longevity of its action and to delay the development of dyskinesia. The authors show a strong genetically defined level of comorbidity between Parkinson's and Crohn's disease, as well as between Parkinson's and schizophrenia. In Dr. Christine Miller's article, The Evolution of Schizophrenia, a Model for Selection by Infection, with a focus on NAD, the author contends Mycobacterium tuberculosis can either cause schizophrenia or tuberculosis through the dysregulation of the kynurenine pathway. Mycobacterium tuberculosis, rather than causing schizophrenia through the infectious process, tuberculosis exerts selective pressure to cause genetic change over human generations, resulting in a higher prevalence of a resistance gene that conferred a greater predisposition to schizophrenia. It has been shown that infections with viruses, parasites, and bacteria result in a reduction in tryptophan levels and enhanced levels of kynurenines in the plasma, serum, and cerebral spinal fluid. Tryptophan is metabolized in mammals via the kynurenine pathway to yield three neuroactive substances: kynurenic acid, which is neuroprotective, hydroxykynurenine, and quinolinic acid, both neurotoxic. The ratio of tryptophan to kynurenine and related metabolite neopterin reflects cellular immune activation. Neopterin concentrations and kynurenine tryptophan ratios were increased both in serum and cerebral spinal fluid of patients as compared to controls. Serum tryptophan was lower in patients. Decreased tryptophan concentrations and increased kynurenine and neopterin were found in the cerebral spinal fluid of patients with Lyme neuroborreliosis. Pulmonary tuberculosis patients had significantly higher kynurenine concentrations and significantly lower tryptophan concentrations than the controls. Serum and urine levels of neopterin were significantly higher than all the other groups. A 1958 French study featuring tryptophan and Mycobacterium tuberculosis hominis revealed that tryptophan is bacteriostatic to the organism, both in vivo and vitro. Borrelia burgdorferi have been found in stinging flies, mosquitoes, mites, fleas, ticks other than deer ticks, white-footed mouse, shrews, chipmunks, deer, cattle, horses, American robins, songbirds, migratory passerines, any ground-feeding bird, reptiles, dogs. Dr. Mattman was convinced that Lyme disease is transmissible from person to person. B. burgdorferi have been found in tears, blood, breast milk, vaginal fluid, and sperm. A new study suggests that Lyme disease may be sexually transmitted. The presence of the Lyme spirochete in genital secretions and identical strains in married couples strongly suggests that sexual transmission of the disease occurs. There is always some risk of getting Lyme disease from a tick bite in the woods, but there may be a bigger risk of getting Lyme disease in the bedroom. Borrelia burgdorferi were found in 100% of the vaginal fluid and 50% of the sperm of Lyme disease-confirmed patients in this study. According to Dr. Burgdorfer, the Lyme disease spirochete is far more virulent than syphilis. Dr. Alan MacDonald, featured in the Lyme documentary Under Our Skin, uses John Stokes' 1944 classic text on syphilis, Monoclinical Syphilology, as the model for what Lyme disease can do in the body. Treponema pallidum, the bacteria which causes syphilis, has been called the great imitator because of its ability to mimic other diseases. Sir William Osler stated, Know syphilis in all its manifestations. Know syphilis, and the whole of medicine is open to you. The bacteria Borrelia burgdorferi has also been called the Great Imitator and has been implicated in over 300 diseases. In the Lyme documentary Under Our Skin, Alan MacDonald tested 10 Alzheimer's brain specimens from the Harvard University Brain Bank and found Lyme DNA in 7 of 10. Dr. Alan MacDonald notes that there are over 100 different genotypes of Borrelia burgdorferi in the United States, and the American Lyme test, recommended by the Infectious Diseases Society of America, IDSA, tests for one bacteria, the B31 strain. B31 was derived from a tick and not a human host, and consequently has a poor diagnostic success rate. European doctors use 3 different bacterial strains for their borreliosis test. The Infectious Diseases Society of America recommends between 2 weeks to 1 month of antibiotics to clear Lyme bacteria, when sometimes years are required to clear chronic infection.